Hello and welcome back to our Arthritis Ireland conversation series. I'm Gráinne O'Leary, Chief Executive of Arthritis Ireland. In this recording, we will discuss the topic of being fit for surgery. Our mission in this series is to bring you up-to-date information on a range of conditions and treatment and management. Today, I'm joined by Professor Brian Devitt, Consultant Orthopaedic Surgeon at the UPMC Sports Surgery Clinic. Brian is an internationally trained orthopaedic surgeon with subspecialty expertise in knee and hip surgery. Many people with arthritis find that having surgery brings about a dramatic reduction in their pain and an improvement in their mobility and quality of life. This recording aims to create an in-depth interview providing essential insights, practical tips, and supportive advice on how individuals with arthritis can best prepare for surgical procedures. And thank you, Brian, for joining us today.
Thank you.
So I'll start by asking you, what do you think are the most important steps people should take before they have surgery?
Well, I think patients really need to be, I suppose, in the right frame of mind for surgery is really important. They also need to require surgery. I think that having the information provided by the specialist and going through the process that they feel they're in the right stage of their lives for surgery. The right frame of mind then is really important. And I think that those two go hand in hand very much so. You need to be physically prepared, you need to be emotionally prepared, psychologically prepared, and also administratively prepared as well. You have to get things in order in your house, you have to get shopping in, all these little things that people forget about are really important. So all of this, there's plenty of time for this once you've had the consultation and once you have been told that surgery is an option. I think then you go about getting all the other bits and pieces in place.
Okay. So let's maybe start by talking about, things like fitness. How does maintaining or improving fitness levels, impact, recovery outcomes after the surgery?
Yeah, I think fitness is really important, just having a general level of fitness. Having arthritis, particularly of the knees or hips, it does make you a lot stiffer. So doing exercise can be quite challenging, but it doesn't mean you can't do some form of exercise, like low impact exercise, like swimming or Pilates is really, really important. Fitness is also good for our mental health. And I think that having a good level of fitness really improves our ability to rehabilitate as well. So we talk about prehabilitation. People go through a similar set of exercises before surgery that they'd be expected to do afterwards. And it just makes that transition to the post-operative phase much, much easier.
Are there, specific types of exercises or physiotherapy routines that you recommend before surgery?
Yeah, I think you have to be cognizant of the fact that patients who have arthritis are going to be in pain, they're going to be a little bit stiff. So exercise is not always that easy. So really we recommend low impact exercise. We have recently introduced the concept of using pedals. It's not just an upright stationary bike, but small little pedals you put under your seat. And we get patients to use this post-operatively, but we encourage them to purchase the pedals pre-operatively. They're not expensive, maybe €30, and they're really, really helpful in terms of getting that knee moving. The other type of exercise is the likes of acroaerobics or hydrotherapy is really important because it's low impact. It's also a really nice social interaction with their people of similar age, and it tends to be a more elderly population who have arthritis, and therefore it's really important that maintain that social link. And exercise shouldn't really be seen as a chore; it should be seen as a pursuit to meet people and
be social as well.
Yeah, and something that improves your mental health really.
Moving on to the whole area of nutrition, kind of goes hand in hand with exercise and physical activity. What role does nutrition play in preparing the body for surgery and healing afterwards? Yeah,
it's really important. I think nutrition is key. You have to eat well, you need plenty of protein. We're even looking at supplying creatine afterwards because particularly, there's a lot of muscle breakdown and atrophy after surgery. So the likes of creatine has been shown to be very helpful in that period. We've recognized in our practice how important it is. We've actually got a nutritionist to come in and work with us because at the end of the day, I'm a biological carpenter, as I say, in terms of an orthopaedic surgeon. I'm not a specialist in nutrition, but we really try to impart how important it is. But it's best to put people in front of those who are expert in that area. And that's the philosophy we have, is try to be quite holistic around it. But eating well beforehand is important. Maintaining a good body weight is really key as well. And there's certain patients who are overweight who come to us overweight, and we realize we're probably not the right people for them at that time, that losing weight can be really important. But you'd find that people who are overweight are often malnourished. So it's really important not to just assume a level of nutrition. You have to assess it. And some of our blood tests that we do are really important just to make sure someone is well nourished, particularly the likes of the proteins and albumin and stuff like that within their blood. So nutrition is really important.
I mean, back to that whole area of weight, I suppose. If somebody is overweight, is it recommended that they lose weight before surgery?
Yeah, I think within reason. I think that we often hear the trope is that people said, I can't lose weight because I can't exercise. But we recognize that losing weight is not just about exercise, it's more about diet. But exercise is important because if you're, not able to have those endorphins with exercise, then you're probably more likely to reach for the bag of Doritos on the couch in the evening. And so, but having an ability to do low impact exercise gets the endorphin levels right. And it's just that kind of routine, that regime that people have introduced, which is a healthy living. And that's really important with nutrition.
So would you recommend people get advice around, weight or?
Yeah, particularly if they're struggling with it and if their diet is not great and they just want, an expert opinion. I heard we had one of our colleagues who's a bariatric surgeon gave us a talk recently, and he said, like, people who are obese coming to us, and he said telling someone who's obese to lose weight is like telling someone who's depressed to cheer up. So it's not really just good enough to say it to someone. You have to give them the opportunity to engage with a specialist who can try to change their eating habits.
So when it comes to people living with other health conditions, things like diabetes, high blood pressure, how might they manage those conditions before surgery?
Yeah, so one of the things we do is, as part of our clinic and within the hospital, is we bring patients to what we call a pre-assessment clinic. So at the pre-assessment clinic, there's physicians, there's specialists in different areas, anaesthetists, cardiologists who run that. And essentially what we do is we make sure we optimize all of their other health conditions. That in reality, you're not going to cure diabetes or eradicate cardiovascular disease, but we want to make sure that they're well managed so that come the time of surgery, there's no issues or as few issues as we can possibly avoid or mitigate. It also means that we're less likely to have cancellations for reasons that patients can stop medication they need to stop before surgery, and they're given plenty of advice, which is really key.
Let's talk a little bit about lifestyle changes. Things like smoking, reducing alcohol intake. What type of lifestyle changes make the most difference, to surgery outcomes?
Yeah, well, I think smoking we definitely regard has a very negative outcome on surgery. It's poor wound healing. There's greater risk of infection, and so it's certainly to eradicate smoking would be very important. I think, as we probably all say as doctors, everything in moderation. I think that to cut out alcohol entirely may not suit every individual. They might have be used to a drink or something of a weekend. And I don't think it's really shown that to eradicate that entirely is going to be that much more, make a bigger difference. But really just having everything in moderation, having a healthy diet, like exercise as part of your lifestyle, and not having excesses of alcohol or any other type of drugs or like that, which certainly wouldn't work. But thankfully most of our population who come have really reasonably good kind of lifestyle choice, or have made good lifestyle choices.
Okay. You mentioned at the very beginning about the emotional side of things when you're entering into surgery. What are some of the common challenges emotionally that patients face before surgery?
I think it's anxiety, as it probably is quite important, and just not being prepared. I think that people come in and they probably have expectations about what the surgery entails. And I think it's really incumbent upon the surgeon to try to give them an idea of what the whole process is going to look like. So if people aren't aware of things, it tends to breed anxiety. So we sit down and we explain, how long they're going to be in hospital for. We explain about the pre-assessment clinic. We explain that they're going to be in pain. And I say to patients, we have a few little phrases. I said, pain is inevitable, suffering is optional. So we have little things that we do to reduce pain, like using ice afterwards, using the pedals, as I mentioned, appropriate medication. And one of my favorite phrases is or he or she who has low expectations is never disappointed. So I think sometimes the first consultation, or when the consultation you book surgery, it's about realigning our expectations. Sometimes as surgeons we have low expectations, the patient has high expectations, and we're trying to bring them to an equilibrium. I think that's really important, and that comes with communication. And the negative emotions of anxiety can be crippling for some people, and just telling them hurting is not harming. You need to, when you feel pain afterwards, you need to continue moving, because that's really important. So don't associate pain with stopping, and that's really important. But pain to an appropriate level, obviously, and that's really important in terms of communication.
Do you ever, recommend things, mental health strategies such as, mindfulness or even counselling sometimes to help prepare a very anxious patient?
Yeah, absolutely, we do. So I often tell patients a story of a patient of mine from Gippsland in rural Victoria. He was a farmer, and he got confused and came in at a 6-month visit rather than a 6-week visit. And I asked him, did he have any pain in his knee? And he said, occasionally he had pain. And I said, when does that happen? He said, after shearing 50 sheep. So, and he told me something really profound at that time. He said, I quickly realized it was a case of my knee getting used to me, and not me getting used to my knee. So it was just a little bit of a paradigm shift that he said he went about his life and his knee followed suit, rather than him sitting there looking at his knee for the duration of the rehab and then worrying about it. And I think for me, I often tell that story to patients just to give them a little bit of an idea that they can get on with their life.
Yeah, it's a different way of looking at it.
Yeah, they might suffer a bit of pain, but hurting's not harming. Go off and do what you want to do, and your knee will follow suit. So it's just a little bit of a paradigm shift. And the other thing we've done is we've also, as part of the holistic viewpoint, we have a psychologist who we work with, so a rehabilitation psychologist. And so if we see someone who's particularly anxious about the whole experience, we might suggest that they have a consultation with the psychologist before surgery, as forewarned is forearmed, or after surgery, which is often very helpful.
I might just go back to that point you were making about pain being inevitable, but suffering being optional. Could you speak to us a little bit more about that in terms of pain management, particularly post-surgery?
Yeah, I think it's really, really important. I think, pain is probably the factor that causes most anxiety for people afterwards. And I think speaking about it to patients a lot of the times allays their fears. The few things we do a little bit differently nowadays is we get patients moving straight away after surgery. So within 4 hours of surgery, patients are up and walking. And to allow us to do that, we have different types of anesthesia we use. So we give them sedation so they're nice and relaxed during surgery. Afterwards, then during surgery, we give lots of local anesthetic so that it prolongs the pain relief afterwards. So this allows patients to move. And once they get up and move the same day, it really makes a big difference. The other factors we've looked at are the likes of using pedals, so we mentioned previously. But one of my colleagues in the Gold Coast has done a randomized control trial where they've shown that using pedals when patients have pain actually reduces the requirements for narcotics. And the narcotics are a medication that are very effective, but also they have some side effects. So the quicker we can get people off them, the better, which is fantastic from our perspective. Then we look at the likes of cryocompression, so ice and compression to reduce pain afterwards, which is really effective and also reduces the requirements for narcotics. So these factors are really important. Movement, I think, is really key to reducing pain after surgery. So we try to encourage that as much as we can, but also respecting swelling and giving anti-inflammatories and bringing that down is really important.
Okay. So when it comes to, support systems after surgery, how important is that support system, be it family, friends, carers, for the whole recovery process?
Well, I think support is really important for patients, but you have to be aware that certain patients will differ in terms of what level of support they require. Some people are very independent, whereas other people are more reliant upon their relatives for care. So I think these things are really key. We like to provide some information regarding the requirements that they would have afterwards, and our nurses are fantastic to provide that. I think just giving them an awareness of what to expect is really important as a support mechanism. So I think they're the real key factors.
I might just ask you a follow-on question just about logistics, post-surgery in terms of, I suppose, maybe a person's personal circumstances, their living circumstances, etc. Could you just tell me a little bit more about things a person might need to consider?
Yeah, I think the logistics really important. So just to give patients an idea how long they're in hospital first, I think is really important. So normally following a knee or hip replacement, you're in hospital for 2 to 3 nights afterwards. So sometimes if patients are traveling for a distance, they'll come in the night before, but normally 2 to 3 nights post-operatively. We've seen quite a bit of a sea change in terms of how quickly we rehabilitate people nowadays compared to maybe 10, 15 years ago. The patients are up walking the same day as surgery, which is great. We also have tried to get them independent with crutch usage within a day or so, and then get them doing the likes of stairs before they leave. So these are all the criteria that the physiotherapists use to make sure they're fit and safe to go home. In terms of the logistics going home, we encourage people to use stairs, but it has to be realistic that you don't want to be going up and down stairs all the time. So I often tell people, if you're going upstairs, make sure you get all the things you need from upstairs before you go down, because if you get your glasses, it's a pain. But whether patients require rehabilitation or not is very much individually based. If you're living alone, it might help to have some respite, so someone can cook your meals or be available. But a lot of times people want to get home into their own bed, and it makes it much more convenient to get a better night's sleep. They can also titrate their own nutrition based on what they like. Sometimes you go to hospitals, you don't particularly like the food. So there's been no evidence to suggest that going to rehabilitation afterwards is better than doing self-directed rehabilitation. I think that's important for patients to understand. So we'll give you the tools, we'll give the exercises. It's just a case of doing them. And the first 2 weeks are challenging, but they're not horrendous. And that's really important. We want to make sure the pain is under control before patients go home. That's really important.
You mentioned there about expectations. What mindset or expectations should people have going into surgery and then the rehabilitation afterwards?
Yeah, I think having too fixed a mindset maybe is not always that helpful. I think you need to be somewhat open-minded. I think, you want to expect that you're going to have some level of discomfort. And I think that is just as a baseline, that it's not going to be a walk in the park, excuse the pun. And so we want people to be aware that pain is going to be a part of this journey, but it's not an insurmountable obstacle. We want them to have a sense of resilience, that they need to be ready to get up when they don't want to get up and do their exercise. I think that's really important. Other than that, it's just not catastrophizing about little things that might possibly go wrong, or that most problems that we face are solvable, and you just have to have a kind of an open mindset to be willing to take help, but also to help yourself as well.
Good advice. What questions should patients ask their surgical team to make sure that they're fully informed entering into this process?
Yeah, I suppose the most important question is, are they at the point where they need a joint replacement? Because I think getting to that point is really key. So for me, you see a couple of different types of people. People who come in and they're expecting, me to say they need an arthroscopy or something, a washout of their knee. And I'm then breaking the news that they need a knee replacement, or they are going to have a knee replacement in the future. Now, I would very rarely book that patient for surgery at that time, because they need to go away and assimilate that information. In terms of their readiness, patients tend to know when they're ready. They know they've got pain at night, they're incapacitated by their arthritis, and they know when they're ready for surgery. I think that's really important. Then you need to know about what are the logistics, and oftentimes, it's not necessarily me who provides that information. We've got a really good administrative team are able to give them dates, and they want to look through their social calendar. So someone telling me they have a wedding and this, that, and the other in the consultation, I'm happy to listen, but I'm not the person making that appointment. But then the key factors you need to know about is the complications, potential risks. And we don't dwell on them too much, because any risks that we explain, we have ways to means of mitigating those risks. But just being aware that we're explaining them to them, so that if something untoward were to happen, that there was some awareness of it. Whereas people get very disappointed if they feel that they haven't been given that time for people to explain things.
Yeah. And you mentioned just there about the risks. How can people balance that understanding the risks with the potential benefits of the surgery?
Yeah. And I think that's where, a lot of people will be in so much discomfort with their arthritis, that they'd say, well, listen, whatever risks they are, I'm happy to take them. Now, if the risks are very high, well, we wouldn't be doing the surgery because it's not worth it. But the risks are very low, and it's all just being a bit sensible. But it's also giving the patient the awareness that if they see any signs of infection or something, that they present really quickly, that we can eradicate things much more rapidly and efficiently if we get people presenting early doors. But we also don't want to instill a level of fear where they're looking at their knee every second and they're afraid to do things because they might get infection or something like that. So I think it's just a balance, and that just comes with our level of comfort in being open and discussing these things and just giving them some figures that say it's very, very low. So that's the key.
So Brian, how do you advise people to prepare for the first few weeks after surgery?
Yeah, I think the first few weeks are the hardest. There's no doubt about it. As I mentioned earlier, I think just, having the date set in your mind. A lot of people, say, I want my knee done yesterday. But once they're given a date, they can really focus, because we can put up with anything as long as we know when it's going to stop. So if you have pain, so I think that's key to people, is having the date. Then I think it's, as I mentioned as well, it's just that saying, listen, you're going to have a level of discomfort for a period of time. It doesn't stop you moving, but you'll be rid of that dull, aching, gnawing pain that wakes you at night. You might have a different type of surgical pain, but that will pass. And I think given the reassurance for that, but just really, steel yourself for a couple of days. It's going to be uncomfortable. You're going to have a bad night's sleep. You're going to fall asleep in the middle of the day on occasion. That's fine. That's part of the rehabilitation process. You'll have your fluctuations in mood, but you need to, try to not catastrophize, and really just that this too will pass and you'll get over it, like the vast majority of people do. So be positive. I'm really trying to impart a level of positivity for the patients. Just
following on from that, in your experience, what distinguishes people who, recover well from those who might struggle?
Yeah, and if I could spot them straight away, it'd make my life easier. But then, how would you manage it? Because you're going to deal with patients based on their condition, not on their personality type, so to speak. But those people who tend to do well, they just get on with it. They're just no nonsense people. They tend to not really suffer too much anxiety. They don't worry. They listen. They trust you. They do what they're told. People who tend to do badly are people who are really hyper anxious, I find, and that they all get there in the end as well, but they struggle a bit more. Not that they do badly, so to speak, but they struggle more. So perhaps with them, they might benefit from some speaking to another patient who's gone through it, so they can really get into the weeds of these little things that stress them out. But yeah, it's hard to know, but we tend to be able to spot people. Do you know those people who you need to, I suppose, be a bit more encouraging about, put your arm around their shoulder and spend some time afterwards sitting down with them at eye level, and not just as a quick kind of cursory post-operative round. You might need to talk to them a bit more. You recognize those people, and other people you're doing the ward round and they're already on the corridor doing the laps. So those people that you don't worry about.
Sure.
But everyone has points where they're going to be a little bit vulnerable, but we really want to just get them to build up a level of resilience to get through it, which is key.
Okay. And again, in your experience, what are the key reasons people usually decide, it's the right time to go ahead with surgery?
Yeah, I think it's when it really affects their quality of life. I think we spoke earlier about pain at night, and that's really something. It's very hard to have a good quality of life if you don't have a good night's sleep. We see that in young mothers or parents of children when they're not sleeping. It's the rest of the day is pretty difficult, and same with people who have arthritis. When they can't have a good night's sleep, they really struggle. And that's where getting good sleep afterwards is really important as well, as best we can. So yeah, I think that's the main thing in terms of the readiness with pain. Then it's how it affects your ability to do things on a daily basis, like putting your shoes and socks on, going up and down the stairs. Is it making you more socially isolated? And if that's the case and there's a solution to it, then it's probably the right time for surgery.
Okay. So how can people make sure they've had enough time, and enough information to feel confident in the decisions they're making?
Yeah, it's difficult because it's very individually based as well. Some people don't even want to know the details; they just want to go ahead and have it done.
Yeah.
While other people want to know the minutiae of the details. I think the time period between our consultation and when they have the pre-assessment is very important, because a lot of times they'll do a little bit of their own research in that time period, so they have more of an awareness. We provide people with patient information leaflets that has a lot of the pathway. But when they go to that pre-assessment clinic, they meet other patients there, some of whom have had surgery previously, so they can impart their knowledge and experience. And then it's also the nurses who are there, provide a lot of the information about what to expect. And we often get phone calls about people just looking at logistics, when do I fast from, all these things. So beforehand, we have people who are available to provide all that information, but certain people can make a decision really quickly, and other people need to think on it. And it's a big decision, so I would respect either approach.
What kinds of concerns or doubts do you often see in patients, and how should people maybe address those before proceeding?
Yeah, I think the biggest doubt is, is it something that they need to have? They need to have surgery. Are they making a decision? Because it's a very important decision to make. When we're training, we have the phrase, people have to earn their knee replacement or earn their hip replacement. I always kind of wondered what was that about, but really it's a case of not pulling the trigger for surgery, a big surgery, too early. And I think that's really important. So that's the biggest doubt that people have, is are they at the time they need it? Yeah. And oftentimes when you give them enough time, they'll come back and come tell you, I now need to have it. So that's the biggest doubt, and that's the most important doubt. Other doubts are they doing enough? Are they exercising too much? Are they taking the medication? And it's easy to solve those problems. It's very clear, based looking at someone's knee, asking about their pain relief. But the biggest doubt is it the right time?
Okay. Yeah. Could I ask you to talk a little bit more about, younger patients that you might encounter in your practice, and maybe considerations for them, and I suppose issues around maybe putting surgery off because people sometimes might feel that they're too young to have surgery, etc. Could you speak to us a little bit more about that?
Yeah, I think that's a really important group to consider, because I think what we're seeing is a lot younger patients having surgery for arthritis nowadays. There's probably a direct correlation between, having had previous surgery in your adolescence or early adulthood and requiring joint replacement surgery in relatively early phase of your life. And so these patients tend to kind of be aware that they may be looking down the barrel of joint replacement in their 50s or 40s. We definitely try to postpone surgery as long as we can, and we do everything we can to do lesser surgery where possible. But sometimes patients are really badly incapacitated by pain, and we have to go ahead with surgery. One of the things that we'll find is that if we can avoid doing a total joint replacement or do a partial joint replacement, that's often easier for patients to manage. But we do it in the knowledge that they may require a revision surgery later on in their life. But there's some people who will kick it down the road as long as they can and leave patients in an awful way. And one of the things you have to be aware of is that if you're developing significant deformity, that your ability to correct that can be reduced if you postpone it too long. So I think we have to be a balance, that we want to try to avoid surgery as long as we can, because the inevitable of having revision lies there. But also you want patients to be able to function. And if they can't function and can't get good night's sleep, they can't get around and play football with their kids or get out and walk, then there is a solution for it. But they have to be very much aware that they might require revision surgery, and the same risks apply to them as all patients having joint replacements. But it just takes a bit longer to have a proper conversation to explain all of these factors.
So finally, what are your top tips for somebody who's considering surgery but not sure if they should take that step?
Well, I think give it time. I think that time will reveal when you need surgery. And I think to rush into something is never a good idea, particularly with something as important as a knee or hip replacement. And once you give it time, you'll realize how much it affects your daily life. If you can't sleep, as I mentioned earlier, it's very difficult to function during the day. If you're struggling with your mobility, going up and down stairs, it makes life difficult. You become a little more isolated. So all of these factors, that this joint replacement is a great solution to give you a new lease on life. But you want to do it at the time that's most appropriate, when you feel you need it most. So that's my advice.
Okay, thank you. Good advice. Brian Devitt, thank you very much for joining us today. Really appreciate your time. And thank you very much for watching. For more information on surgery and arthritis, please log on to our website at arthritisireland.ie. You can also get further support via our online Facebook groups or via our helpline 0818 252 846. Thank you very much again to Professor Brian Devitt for joining us and for sharing his insights and experience. We look forward to seeing you again soon.